I'm Gus Kapler, and 83 years old. At age 30, having just completed my training at the Medical College of Virginia, I served as an Army trauma surgeon at the 85th Evacuation Hospital, Phu Bai, Vietnam, 7071. We supported the 101st Airborne Division between Da Nang and Hue. I repeatedly witnessed the devastation of war on body, mind, and soul. I remained traumatized and experienced post-traumatic stress. Storytelling was my mechanism for dealing with my PTS. Not the more serious D, the disorder. PTS plagued me for decades without my comprehension. In retrospect, I understand that in storytelling, I was searching for acknowledgement and gratitude. I was repeatedly disappointed. In 2015, I sorted through my reiterated stories and wrote Welcome Home from Vietnam Finally, a Vietnam trauma surgeon's memoir. The following are excerpted from this book. Page 23. The moral compass of a safe society does not translate to a war zone's sanctioned killing. All who serve in combat are changed forever. One observes and participates in horribly unspeakable occurrences. In accepting the new definitions of a war zone moral code, it is intensely imperative that the combatant's violence be confined within the parameters of warfare that avoid atrocities. This ability to restrain emotionally driven responses at times is a very gray area when adrenaline driven during a firefight and just grasping for survival. Being unable to save a battered, wholesome 18-year-old patient, despite all your skills in the operating room, traumatizes one's soul. Killing a fellow human being tears the soul apart, and if not healed, results in a weakened and fragile psyche. The clinical dysfunction was referred to in the 16th and 17th centuries as nostalgia. The Civil War, it was the soldier's heart. Shell shock in World War I, and battle fatigue in World War II. Now, all the world recognizes the term post-traumatic stress disorder, PTSD. Page 24. My desperately injured patient was a grunt who, while patrolling through a small, recently used enemy clearing, spotted a piece of styrofoam on the jungle floor. What does a typical 18-year-old do but bend over and pick it up? The enemy knew well the psychology of our young soldiers, and predictably, the styrofoam had been booby-trapped. His was a major injury in the lower extremities, their arteries, the perineum, genitalia, urinary bladder, and abdominal organs and vessels. This young man's prolonged surgery required 106 units of blood. He survived the surgery and regained consciousness, but due to the massive tissue damage, prolonged surgery, even with time-saving, surgically acceptable shortcuts, and massive transfusion volume, he developed renal, that is, kidney failure. I accompanied him on a flight to Saigon's 3rd Field Hospital for dialysis and was abruptly dismissed by their staff. I had poured my heart and soul into this boy. I was totally invested in and committed to his survival. I was consumed by him. Then suddenly, I had to turn off the physician and compassion switch and return to the 85th vac. To mentally survive, one has to be efficient, drawing boundaries, and move on to the next patient with an unfettered mind. He was my true first patient after residency training. There, one's actions are monitored, dissected, and altered by a physician more senior in the academic hierarchy. I was now on my own. A week later, I was notified that he had died. Page 126. For all its drawbacks, the operating room was where I felt personally complete. In charge, in my element, useful, fulfilled, and unbothered by military bullshit. When concentrating on a procedure, I was in my own world and not in Vietnam. There were few intrusive thoughts, for if allowed admittance, they would interfere with and degrade my efficiency. This experience, which I did not choose, was shaping me into a mature, capable, self-reliant surgeon.